I'm Dr. Tom Selva. I'm a staff pediatrician at Women's and Children's Hospital out at the Green Meadows Child Health Clinic, or Pediatrics Clinic. Been here 22 years. The division chief of the General Pediatrics Division, and also the medical director of the department. It's been well proven over the last 20 or 30 years that secondhand smoke has bad effects on kids. As a matter of fact, the American Academy of Pediatrics took a very strong stance about the effects of secondhand smoke. I think when the Surgeon General has brought this up as one of the reasons you shouldn't smoke. We know clearly it's linked to an increased incidence of respiratory infections in children, particularly small children. We know that there are increased ear infections in those children. We know that children with asthma tend to have worse outcomes when exposed to secondhand smoke. Remember that secondhand smoke is just very fine dust. That's all it is. That's why it gets stuck to everything in your house. It's on your clothes and your hair. Well, that very fine dust gets into the smallest airways of children, even though their airways are very small. It's all the way out into their air sacs and causes irritation. So we know that children are more prone to respiratory infections anyway. This just makes them worse. It's easy to say you should quit. It's hard to do it. So how can we help you do that? So some simple things are, there are some programs that people can tap into. There's one at the health department downtown. A lot of employers now are offering free medication to help stop cigarette smoking because they see it as an advantage. If an employee stops smoking, they have fewer health problems, so their health care costs go down. But we also talk about some practical things. You know, if you're going to continue to smoke, don't do it anywhere in the house. It doesn't matter where you are in the house, it will affect your child. You need to do it outside, preferably with a dedicated piece of clothing to cover your clothing. Remember that babies are held close to parents, so if even the parents are smoking outside, the cigarette smoke's on their clothes, baby's face is in your clothes, so they're getting exposed. And the time to start making that decision can be any time, but a perfect time is when you're considering having children. Many mothers, we know that smoking during pregnancy is bad for your baby. They're smaller, they more risk for prematurity, etc. They're more stressed. Many mothers will make the decision to quit during pregnancy. So once you've quit during pregnancy, sustain that gain. Don't start again after you deliver the baby. You have 9 months while you're pregnant. It's a great time to talk to the rest of the family and say, okay, we've got 9 months to make sure that none of us are smoking by the time the baby gets here. It's a great opportunity for change.